Name the three hormones produced by the thyroid gland.
Three hormones produced by the thyroid gland: growth hormone, then one for follicle stimulating hormone, and another one is
Moving to pituitary gland. Where is the pituitary gland located in the brain?
just below of hypothalamus. And
Good. Yes. And what is this part called?
this part,
Hmm.
cerebellum.
And this is
Brain stem, which is connected with the spinal cord.
and can you locate the midbrain?
Midbrain.
Hmm.
Midbrain is here's from pineal.
Can you locate the pons?
Pons is here.
Okay.
The brain is from here.
Okay then. What these two parts of the pituitary gland?
This two part,
Hmm.
pineal gland, just near
Name the parts of the pituitary gland.
anterior pituitary gland and posterior pituitary gland.
Yeah. And the hormones secreted from the pituitary gland.
Growth and development hormone, follicle and luteinizing hormone, then other then other is prolactin hormone, adrenocorticotropic hormone.
And moving to the second section, we have to discuss the diseases of the different systems. First, we start with the nervous system, and out of these diseases, which two diseases you want to discuss today? First one is dementia, then Parkinson, migraine, and then stroke.
Dementia.
You want to discuss dementia? Yeah. Please discuss the conditions. Describe what happens in dementia.
Dementia is not a specific disease. It's happened through different various symptoms like memory problem, thinking, and
What happens in dementia? Is there any damage to the brain or any part of the brain?
Yes, it damages the cells of the brain.
Okay. What is the cause of the dementia?
The cause of dementia is cause of dementia. This lack of memory power. It may be causes stress, some other.
Okay. Give at least 3 signs and symptoms. What happens in dementia?
Dementia, confusion, and short-acting memory loss, and other thing is that memory loss, thinking problem, social inabilities.
And what, according to New Zealand statistic, what is the greatest risk factor for the condition?
According to the New Zealand, older age.
Give 2 ways to manage the condition. How you can manage the condition?
To manage this condition, we can provide a good social environment. It's meant to make them socialize and good support care.
And what other diseases you want to discuss? Migraine, Parkinson or stroke?
Parkinson.
Okay. Describe the condition, please.
Parkinson is a neurological chronic disorder which is happen through dysfunctions of motor, and it is the imbalance between dopamine and acetylcholine.
What are the causes of this condition? Parkinson?
Cells are damaged in substantia nerve, so it's happened the lower level of dopamine.
Okay. Give at least 3 signs and symptoms.
Sign and symptoms: rigidity, tremors, then involuntary action.
Which medicine is mainly used for treatment of and management of this condition?
Mainly levodopa.
The question is this condition prevalent in New Zealand or why?
Parkinson. I think it is prevalent in New Zealand. It's been, can elaborate.
Moving to the next diseases, that is the GIT tract. Which 2 diseases you want to discuss out of gastritis, GERD, peptic ulcer, constipation and diarrhea?
Peptic ulcer and constipation.
Okay. Please describe the condition.
Peptic ulcer is a term where happen the forms sore and lesions in lining of stomach due to the imbalance of enzymes which is secreted by stomach and digestive.
Give 2 causes of the condition.
Causes of the conditions: bacteria, H. pylori bacterium and NSAIDs, using of NSAIDs.
Give 2 signs and symptoms.
Sign and symptoms: bloating, nausea, vomiting, heartburn.
And moving to constipation, please describe the condition.
Constipation is a digestive disorder which is happen with infrequent bowel movements in stomach and
Give 2 causes of the condition.
causes inadequate fluids intake and less intake fibrous food.
Okay. Give at least 4 ways to manage the condition.
To manage these conditions, need to do regular exercise and take adequate fibrous food like vegetables, fruits and legumes. And other thing is that take plenty of waters or fluids.
Anything else?
Constipation. That's it.
Okay. Moving to the diseases of endocrine system, which diseases you want to discuss out of hyperthyroidism, hypothyroidism, diabetes mellitus and Cushing syndrome?
Hypothyroidism.
Please describe the condition.
Hypothyroidism is a condition where thyroid gland is not able to produce the sufficient thyroid hormone which needs the body.
Okay. List some causes.
Causes is immunothyroid. Then another one is iodine deficiency. Then some radioactive therapy.
Causes, you have to discuss the causes.
Causage.
Why is this happening? Hypothyroidism.
Causes. It's due to some stress. Hypothyroidism causes.
Okay. What is the most common cause in Newfoundland?
Autoimmune.
Give at least 3 signs and symptoms.
3 signs and symptoms. Dry skin, weight loss, and hair loss.
Anything else?
Less loss weight, hair loss, dry skin, and
Okay. Give at least 2 ways to manage the condition.
to manage the conditions, need to take medicines,
Which medicine?
levothyroxine.
We are talking about hypothyroidism. Hyperthyroidism.
I'm talking about hypothyroidism.
Hyper.
You asked me for management of hyperthyroidism. Management of hyperthyroidism need to take hyperthyroidism.
Okay, very good. Which next disease you want to discuss out of hypothyroidism, diabetes, or Cushing syndrome?
Diabetes.
Please describe the condition. What happens in diabetes?
Diabetes is a condition where the blood sugar level is high in bloodstream. It is called hyperglycemia. Insulins are
List at least 4 risk factors.
4 risk factors of diabetes. It means the causes. No.
Like the people who are more at risk for having diabetes in their later life.
Blurred vision.
No. What I'm saying, like, you can say how you can say to the people, please do this, otherwise you can develop diabetes or have diabetes in your later age. The people who are at risk, higher risk, what are the risk factors?
Risk factors to
What
take
can cause?
more alcoholism is the risk factor.
Okay.
Smoking, and other is weight loss.
People who are overweight.
They
Okay.
need to weight loss.
And is there anything else? You have to list 4.
List for diabetes.
Just recall your daily day-to-day life, or we can say
Do exercise properly.
we are talking about the risk factors, not the management.
Yes.
Is there any person who is more prevalent to having a diabetes in the later life?
Didn't get.
Anybody have diabetes in your family?
No.
Any relatives?
Relatives. Some relatives.
Why they have the diabetes?
Because of genetic.
That's what I am saying. That is the
Yeah.
risk factor.
Because I didn't get the questions.
And next,
Next one is genetic and autoimmune.
okay. And give 3 signs and symptoms. What happens when the person has the diabetes?
Sign and symptoms: hungry, thirsty time to time, and frequent urination.
Anything else?
Dry mouth,
That is the thirst.
thirsty. Yeah. some patients have stomach obesity, like
That is not a sign and symptom. We can't say the person if the person is
blurred
obese.
vision is the sign and symptoms.
Yes. And next, give 3 ways to manage the condition.
To manage the condition for diabetes patient, encourage them for regular exercise and
Medication, any medication?
first line medication like metformin and glipizide, glimepiride,
And in the end, what can be the option?
insulin would take.
Okay, then we have discussed. Okay, that's all good for today. Thank you. You can send me next.
Okay, thank you so much.